Thank you very much, sir. In fact, the questions have been very thought-provoking, and as just thought, really, you can't put yourself in a box. As you were talking, it came to me also, and I started taking out some notes on things I need to improve for myself. So it's beyond just what we have heard this evening is beyond one person, is beyond the now, is going to take you for several years. It's going to take you for the future. So I want us to really digest these things. However, we will take some questions. And I think Dr. Eileen spoke, some people had questions. I think when Dr. Nika was speaking, some of the questions had been answered. And Dr. Eileen is still with us, but I think she's in transit. So now somebody asked, is there any future? So Dr. Inka, Dr. Eileen, please, you can answer us. However, I think I'll just read the questions. I think we all have access to the questions also on the chat. So the first one says, is there any future in public health with a background in microbiology? I think we talked about that you can't box yourself. We can do a lot of things. Somebody, I think he was asking for LinkedIn profile for Dr. Helen Onyeka. Both Dr. Helen and Dr. Inka's LinkedIn profiles are available. I think you can just search for them on LinkedIn with their names and you will see it. Somebody also said, I am a vet, that's I think a veterinary doctor, and I'm interested in learning from and working with you. I think the person who was addressing the question to Dr. Elaine, that was earlier. Another one said, hi, as a medical microbiologist, how do one relate food safety and public health? Then the other question talked about, Professor, what areas of microbiology do you think are still underexplored but have potential for breakthroughs? I think Dr. Inka talked about the Agenda 2063. We have to sit and look through it, but he will still talk more about them, and I think Dr. Elaine also will talk more about them. Yeah, I think basically that the other person says, I'm an organic chemist. I'm inspired by your story. Yes, I think this is a compliment. I have interest in quorum sensing. I am an organic chemist, but passionate about microbiology, most especially pharmaceutical microbiology. I have interest in quorum sensing inhibitory studies towards addressing drug-resistant microbes. This is I think the person needs guidance and direction, sort of. So then I have a question for me, and I think one question for Dr. Eileen and is that how can we leverage our local problems for tailored biotech solutions? Nigerian problems. We have Nigerian problems, and I don't think we're doing enough for ourselves in Nigeria. I don't know how we want to really do more. I believe our lecturers can do more for our students also, but I think we're not pushing as much as we should. Yes, I know some private universities are really pushing, but maybe not as much as some other public universities, but a greater percentage of students are in the federal universities and state universities. How can more be done for them? And also, how can we monetize our research? There's so much problem. Dr. Nkai, yes, you say you don't like to think of the problem, but it's like there's problem and we have to really talk about the problems that we face in Nigeria. Because I believe that I was in Amsterdam, I think in May, and it was a sustainable packaging innovation forum. And they were talking about collaborations, and they were showing us there were startups that came to exhibit. There are two from UK, Kelpie and Shellworks. These startups came up from the university. And one of the startups was working on biodegradable materials, producing it, is a packaging, all microbial process. And when the lady finished talking, do you know what I told her? I said, you've just completely described what I did for PhD. And I'm thinking, this is what I did. And some people already come together and they're in a startup and they've made money, they are making money or they've sourced for funds and all that. But we are doing so much. I don't think we know enough how to monetize what we do in Nigeria to advance. So those are the questions. So maybe
Can
Dr.
I?
Inka,
Okay, sorry.
yes, ma, you can go. I think Dr.
Okay,
Inka.
I just wanted to say something. What I'd like you to do, if that's okay, is a challenge I'm giving to you as well. If you list all the problems we have, as in environmental challenges and we have in Nigeria, then we can put heads together and think what is the microbial solution to them. For example, when I was growing up, I lived in Port Harcourt, and there was a lot of pollution going on there in terms of oil flaring. They'll burn all the oil, and I was asthmatic, and there were a lot of people that are asthmatic, in that area because of the burn of the excess the oil because it's useless. So one of the things I dreamt about was, can we not use microorganisms to biodegrade those products? You see, so we can have products that are of interest. There are microbes that will definitely survive and use it to metabolize and produce something.
Mhm.
So, and now, thank God, and what I dreamt about, because I like dreaming about microorganisms, is we can actually use the microorganisms as single cell protein. Then the concept of single cell protein wasn't there. But I thought about that, and my term paper at the university when I did my first degree was on single cell production, single cell proteins using microorganisms and looking for these unusual sources. Like we can use hydrocarbons and other things to produce this bacteria, and then that will solve the world problem of kwashiorkor, lack of proteins. That was my thinking. I wrote all these things down, and now there are certain startups that are working on that. The issue I had with that particular project is thinking if we're to use bacteria as single cells, it's not going to, for us to digest it, is going to be a problem. So that problem, because I did research it intently when I was doing my first degree in industrial microbiology. So, but then the funny thing is, when I went for COP 28 in Dubai, I found a scientist, and he had that same problem. He solved it. And all he did was, because there's some amino acids he produces that cannot digest. And what he did to circumvent that problem was using anaerobes. He used Clostridium. And now he's using it to produce single cell proteins that are replacing protein. So now we're thinking, wow, okay, instead of that flaring of that oil, can we actually use that? Can we find microorganisms that can metabolize that? And then we can use it for protein as food and solve the problem when there's war. People are having kwashiorkor. Do you understand? So there's solution. We'll just have to think about what the problem is. So I challenge you, think of the problems we have in Nigeria. And one of the problems I'm looking at now is, the plastic pollution is a big issue. So what I've done is I've got somebody to go and let's see if we can isolate some microorganisms from those plastics. Okay, if the microorganisms are really surviving in those plastics, is there a potential for those microorganisms to break down those plastics? Will that help us solve the problem of plastic pollution happening everywhere? Do you understand? So what are the problems? How can we use microbiology to solve that problem? So if you can list the problems, we can do another session where we all come together and try and let's call it like, solution probing or something where we can think, okay, is there any microbial application to that? What can we do? So that's a challenge I have for you and some of you
Yes,
that are
ma'am.
here. So the second thing is someone asked a question. So then when I answered this, then Dr. Yinka, I really enjoyed your talk, Dr. Yinka, just to say, and I've not had time to really talk to you, but you're really amazing. Honestly, he's so clever. And I'm his fan, just to let him know. So just to talk about how food safety links to public health. I mean, food safety and public health go hand in hand. Number one, preventing foodborne illness. Contaminated foods leads to outbreaks like you have salmonella, listeria. So that's public health issue. So public health professionals monitor outbreaks, they trace sources, and they help prevent further spread. That's what they do. Because I happen to teach public health scientists, I do teach them at the university. One other thing they do is protecting vulnerable population, like infants, the elderly, immunocompromised individuals, and pregnant women. Those people are at risks. So they ensure that food safety standards are set, and public health policies help safeguard this, group, that are vulnerable. So that's all the things that public health specialists do. Other thing they do that is quite key is in surveillance and outbreak response. They're involved in outbreaks, and I do teach that. I develop a module on that as well. So they play a very proactive role in surveillance and outbreak when there's an outbreak happening. Okay. So, and one other thing in policy and regulation, education and behavior change, they play a role, and global food security. So, public health specialists are just amazing in when you talk about public health and food safety. So they play amazing roles. That's I wanted to highlight that. Then the person that is talking in that vet, I do teach conversion courses for vet and doctors as well at the university, where we're trying to get them to be food inspectors and to work in food area. So I have a conversation with the person and tell them what we do and what courses we teach to, so they have the dual skills as in working in vet and also working in food safety and being inspecting. So they can reach out to me and I can have a conversation, because we have lots of veterinary doctors are converting and doing more work with food safety that we do teach. So that's part of our program at the University of Birmingham. So I'll let Dr. Oyinka talk now. Thank you so much. So don't forget the challenge I've given to you and all of you there. What are the problems? Let's come up with solutions. Thank
Yeah.
you.
Excellent. Thank you very much, Dr. Helen. Um,
Thank
I
you.
really appreciate your compliments, and thank you for very insightful way in which you made my own job easier. The way you spoke during your presentation. Okay,
Thank
so I have a quick yeah quick comments to some of the questions. So I will talk about the area of the question Dr. Akintunde asked about um, translating our research um, into products, into money, basically. And I see two things there. One is that it is first a mindset issue. And this also affected me. So I told you something I've been doing for more than 20 years, free for everybody. When it came to the point that I had to make this a venture, it was difficult. In fact, it was difficult to it was like, oh, turning what you know, your knowledge into money looks like a taboo, which shouldn't be. So there's a mind shift that needs to happen. And that's why it's important that maybe our universities need to integrate entrepreneurship into all courses so that we start feeling comfortable with the idea of money, of commercializing our ideas, so that no, it doesn't, especially scientists. I think we researchers tend to like to do things for free, which is good, but it's also important to be able to monetize some of these things. So the mindset one. And second issue that I want to say that is that we need to start looking at these problems across discipline, not just to look at it as a microbiology problem or as a chemistry problem, but we should look at it holistically. For some of the organizations that I work with now, they tend to not even think about single discipline. It is about how do we solve this problem? And then they bring people from gender, people from the actual core research component, they bring people from policy, and we all look at this together. So tagging on to the challenge Dr. Onyeka gave, it would be interesting and I would be happy to be part of that conversation for us to sit down and take key challenges that we have locally and discuss how we can solve them, bringing people from different perspectives so that we can actually start solving and taking steps. Because obviously, there can be a lot of talk and questions, but we need to start driving towards the answer. Thank you very much.
Yeah.
On the issue of drug resistance microbes, I think the chemist that wants to work with drug resistant microbes, you are in the right place and you're asking the right questions, because new components, new compounds need to be synthesized that can block pathogenic mechanisms, for example, either to replace antibiotics or to be used as combined therapies with antibiotics. So as a chemist, you can synthesize new products. In fact, at the point, there was a research I was interested in. Part of the things I did during my PhD, I looked at the mechanism for biofilm formation in E. coli, and I saw that there were some organisms that didn't have, that they had a mutation, so a defective biofilm formation gene, and that means that they couldn't produce biofilms. And since biofilm is a problem, could there be new compounds that will be synthesized that will create the same effect in organisms that can form biofilm, for example? And that is one work that you as a chemist can do excellently if you can synthesize new compounds. So you have a place. Just look for people who are interested in the questions you're asking, and you can find suitable collaborations there. So thank you very much.
Okay, we have one more question. And she says, how can I engage in online certifications as an undergraduate? And also, is AMI for undergraduates? I think yes.
Okay, I can answer the second question, and maybe Dr. Ellen can do the first one. So most of the learned societies, I mentioned ASN, there's Microbiology Society. There is also Applied Microbiology International. Most times, some of them would give free membership because you are from Nigeria or from whatever country you are, if you're on their list. So as an undergraduate, yes, you can be a member. For some of them, it might just be pay very subsidized cost, but for some others, it is free. So look for them. I started this journey as an undergrad, so there's nothing stopping you. You can apply to some of these people, and it will expose you to a lot that you don't know where the limits will be. Thank you.
Yeah. So I think Dr. Onyeka talked about going to Coursera, Future Learn, Coursera, WHO Lab Certification, Future Learn. I know on Coursera you can also get some sort of scholarship. You can apply for fee waiver on Coursera, especially as Dr. Onyeka also said, you are from Nigeria, you're an undergraduate. You just have to justify that I cannot afford this.
So yeah, that's that's good. And the other courses. So what I can do, I can send you a list.
Yes,
some that are free and some that you pay for. Okay. So and if you're interested in sustainability, there's quite a lot, and you get certification. So what I can, even the CDC microbiology e-learning series, you can get self-study modules covering entry-level lab skills. So I can send you a whole list of it. Because I give it to my students also.
Okay.
So and so you can look at even the broader skills that we need. Yeah. So I'll send that to you if that's okay. Then you can pass it down.
Yes, ma, please. We need the list. I would add it to the key takeaway email so we can send it
I'll
out.
do that. Yeah.
Yes.
I'll email it to you today.
Okay, thank you very much, ma. Lastly, Dr. Inka, how can we be part of the Nigerian Applied Microbiology Network? Or is it open to all everybody? Is it?
So that's open. So basically, you can send an email. I'll put the email in the chat. Basically, send an email and you will be sent that you were interested in joining, basically. And obviously, so the way we started out was that we didn't want it to be all commerce affair, right? We only want people who were genuinely interested in advancing their careers and will contribute in some way. So even if you're an undergraduate, there's something you can contribute. You can, if you have skills in social media, it is contribution. So everybody must contribute. But now we've decided to make it more open. So if you send an email, I will drop that email before we finish now. If you send an email, we will respond to you with the link for for registration, and you can register and we will confirm the registration. So that's the way to join.
Thank you very much, sir. You see, everybody, we need to be intentional. A lot of things will not walk up to us in our houses or in our labs or in our school. We need to go out. We need to search. We need to work hard and look for some of these opportunities. We need to be more open and open ourselves more to different opportunities that are available to us. And I believe that we have a level of clarity, and since the recordings will be available, you can go through it over and over again, learn, digest, take it in, and act, so that we are not just daydreaming. When we put action to our vision, we will not be daydreaming. But if we don't put action, it's just going to be simple daydreaming. I'm dreaming that I want to be, but we have to act. And we will make progress as we go on. So I think we're come to the end of today's session, and I'm very, very, very grateful. I and my team were very grateful